For the new individuals here today, welcome to our second forum on missing and murdered Diné relatives. My name is Teresa Hatafi. I am the Western representative to the Diné College Board of Regents. So the assignment was given to Diné College Policy Institute to help coordinate and organize this cause. But today they're not with us, just me. We have staff convocation, we've had on-site registrations. There's a lot of great things that was going on there the past few days at all the sites. So with that, I'd like to say good morning. But we are here. We support this cause. So today's event is sponsored by the Navajo Nation Sexual Violence Prevention Working Group, the Northern Arizona University Center for Health Equity Research, Navajo Nation Office of the Speaker, Diné College, and Tuba City Regional Health Care Center. And yesterday we had a number of the board members here, and then we also have the board members here again today. So yeah. And then also we've had Delegate Amber Crotty yesterday present here, and then we also had a lot of leadership in the room yesterday. So lots of information was shared. So today we'll go ahead and continue. So today is more of a work group session. We're going to recap in a few minutes, and then we'll be going into work groups. We want to start working and putting this framework together or adding to the framework. So I'll leave all of that to my colleagues that are here also. So Shaya bin betwodni nishla. Ashin ebashichin tkabahe edashichedo tedeshkishi edashinale ado tekkonte aden eyanasha. I'm from Coal Mine, Arizona. And then also my parents are Jack and Bessie Hatafi, and they passed a few years ago. So my siblings and I were still out there at the homestead. We still have our horses, cattle, sheep, cornfields, kids, grandkids, and the whole 9 yards is still out there. So, so thank you very much. And then also for all the support that's here, and then for the individuals who are on the Facebook Live, and then also on streaming also on the websites established by NAU. So thank you very much. So with that, I'd like to say a short prayer this morning. So with that, we'll go into highlights from yesterday. Zoe? So Zoe will provide us the highlights from yesterday. Again, we have drinks, we have food right here. Please help yourself. And then if you go out this door and all the way on around the corner on the other side, that's where we have the restrooms. Then I noticed we also have recycling bins. Yesterday I had a can of soda and I saw all that trash and I had to go out the door. Otherwise, I can just hear my daughter's voice. So please recycle. Thank you.
Alrighty. Good morning, everyone. Okay. Actually, I need the other guy. From yesterday, here we go. All right. Okay. So yesterday we started out with an opening prayer, and then we had opening remarks from Council Delegate Amber Crotty. What do you guys remember about her remarks yesterday? Anyone? Let's start on this side. What do you guys remember from her remarks yesterday? Just one word. It was motivating? Okay, good. Anyone else? Any key words that you remember? Anything that she talked about? Let's go to the side of the room. What do you remember from Amber's opening yesterday morning? Any key words that you remember? So we heard motivating. She's invested, okay. All right, anything else? Volunteers, okay, good. We definitely need the community to participate in our project. Okay, then I talked, and what was one word that I said yesterday when I talked? I didn't talk for very long, I just talked for a little bit. I just said one word like 5 times. What do you remember? What did I give you yesterday? I said it starts with an H. Homework. I said your homework was to listen to all the presentations and to have ideas for today. So that was your homework yesterday. And then we had the Valora, is that right? I know that the pronunciation of the last name is challenging, so I'm not going to attempt it. What do you remember from that presentation? This one right here, 9 o'clock. 199 police officers serving 27,000 square miles. Okay, and so if you actually calculate the rate per 1,000 persons, so I was looking this information up. So nationally, the rate, the rate of police officers to community members is somewhere between 16 and 22 per 1,000 persons. That's nationally. For that number that you just told us, it's like 1.13 officers per 1,000 persons. So that's one of the things that's challenging that we face, is that we have a lot of need when it comes to services. What else did you hear from that presentation? Okay, the process, the monumental event that took place. Good. Okay, anyone else? Anyone? Okay, I always think of that whenever I'm up talking. I always think of Ferris Bueller. Anyone? Anyone? Something do economics. Anyone? Anyone? Voodoo economics. So then we took a break, and then we talked about the Facebook group. It was the history of. What do you remember from that presentation? Anyone? It's a lot of work. Okay. Okay. What about from this side, the back of the room? What do you remember from that presentation? Or over here on this side? No? Nothing? All right. Search parties, okay? Okay. So search parties and always asking permission of the families. Good. All right. What about the human trafficking, exploitation of missing and murdered women? Dominique, that's the gal that was right before lunch. What do you remember from her presentation? Okay. Okay, so you're very informative and you're glad that she came out from ASU? Okay, the thing I remember was that she actually compared a lot of the databases that we had been talking about the last forum, Forum 1. So she talked about the NCIC, she talked about another database that I hadn't heard of. I can't remember the actual name of it right at this moment, but she talked about those, and she kind of talked about the data that's in them, and then she talked about the geographic data, like actually trying to geolocate some of the cases, and if it's possible or not, so that was kind of interesting. Okay, she offered her services. Good, excellent, excellent. Anything else? Anything?
About victims of trafficking have already been involved or suspended from school.
Okay.
And special ed classes, and they've already received social services, so a lot of missed opportunities.
Okay, so a lot of missed opportunities. So folks missing school and other indicators. Good. Okay, so for populations that we could emphasize services around. Okay, good. Anything else? Anyone? All right. And then after that, we heard from Dr. Diné Dale. What were the highlights that you recall from that? What was that? A whole lot? Do you want to use the microphone? Or here, I'll give you the microphone.
It's an honor to meet you again, be in your presence, to hear a live presentation when I had just read about it all the time in the papers. So what I understand now more better and clearer is what I always thought, which is that Native people, indigenous land, indigenous country, what we call Indian country, and that it just reaffirmed for me what I thought, but I didn't know how to say it. What really is going to town about, and that whole cycle of still trying to survive, getting our basic needs met, and yet we're still here to be able to return to it. Maybe start farming, gardening, and we still have all of that ahead of us. So it wasn't like, there's still a lot to do. There's still a lot to learn about. And there was, I had never thought about using the word settlers, so I think it was appropriate now, and all the things that took place when I was growing up. So it was sort of retrospective in a way, and seeing all these points, the events that happen, that are still going on, that we still have, opportunity to intervene on. And our voice just has to be stronger, just has to be more clear, and the F part, which is the caring, which is really what it is, to have that empathy for one another, our clan members, and all of, I guess, 16 plus clans that we have within each person, because it's not just one, it's not just two, it's not just three, it's not just four. So there's a whole society, and maybe we still don't understand the word community. Community, maybe we have a better idea when, from Fort Sumner, and all that. And what I really, really go to the Navajo Nation Museum for is to look at that picture that says there were only 3 reasons why we went to Fort Sumner. And it brought it home for me. We're going to either go to school, become farmers, or Christians. That was the intent. So even all through that, we're still trying to, make a better history, make a better future, using our lessons learned, I guess, and why we still need to have a voice, learn how to use it, to be able to help ourselves. That was it. Okay.
Yes.
What I remember about her is that she's famous. She wrote a book, and I have it. My daughter gave it to me. It's been quite a while, I think. And this morning, I completely forgot. I told her yesterday that I was going to bring the book and have her autograph it, but I forgot this morning. But I think the story she related on Lauren Sinigini, I think that was very, emotional for all of us. My maiden name is Sinigini, and that's why when I first read that paper on her, I thought, which of our family does she come from? And then we started texting each other, calling each other. Do you know what family she's coming from? And we found out she wasn't related to us in any way, but we took, the name, and we started looking into the story. And we were at some of the rally that they had in Winslow. So it was interesting when she went through the whole process of what happened to her. So.
Anyone else? Okay. All right, so this guy keeps going to sleep on me. All right, after Dr. Diné Dale, we heard from the Strands. And what do you remember from that presentation? Okay. Yes. Do you come back?
Thank you, Zoe. I'm Jennifer Diné Dale. I wasn't here for the first conference that was in Shiprock, so I was just here for yesterday and today, and it's a lot of information to digest and then to decide what the strands are or what the focus is going to be. So I'm still at that point of thinking through what I've heard and how does this move towards what Delegate Crotty's objectives are, and how can we be supportive of the work and the vision that she has in relation to missing and murdered Diné relatives. Being a researcher and a writer and an educator and a scholar who's been doing work that is shaped and framed by Indigenous studies, by Diné and Indigenous feminists and queer critiques, and by a theory of settler colonialism and civil rights and human rights frameworks. I would say that as we go through this, we also need to offer an analytics of how we're digesting this work. How does this work, for example, the sociologist from ASU, I would like to know how her work is framed by Diné fundamental law, how it's framed by Indigenous human rights, how she takes up Diné and Indigenous feminist and queer critiques, because these are lenses that can help you interpret and offer an analytical for the work that is before us. And so I think that's really important to do that work. The other thing I thought was really interesting is that after I present, we have the Strands presenting, who are offering us be a different kind of like an opposite of what I'm talking about, because I raised the question of, and this is the questions that our researchers asked was, is it even possible to reform the police? Is that even the question? Is that what we should be thinking about? And what is the work that's been done on those possibilities? Okay, I'm a historian. I know the history of policing. I know that the history of policing is very tied to early slavers who were looking for fugitive slaves. Okay, that's the origins of policing in this country, and so it's important to offer a history as part of the work that we're doing, so we understand what goes into being into these categories of missing and murdered Diné. So thank you very much. I'm still just digesting what I've heard. Thank you.
Good morning. The take that I got from the Strand's presentation was the trauma that young children have when, growing up, and that's one of the topics that I'll talk about when I introduce myself too. But that was one of the things that I took away from them, was that trauma starts, when children are very young. And it all starts at the home. And the other takeaway was a quote that they had said was, "You can't make change until you change." And so I really enjoyed that, and their presentation overall. It really touched on a lot of the things that I enjoy researching and talking about and presenting to people. So thank you.
Thank you.
Yeah, the trauma-informed response, is that what we're talking about now? The trauma-informed response, I thought it was, I noticed that, a lot of parallel or some of the things that were taught traditionally. I thought we already have all those teachings in our traditional teachings. Hajoyat, Hupchiat, Nantini, all the stories that relate to the traditional teachings. I thought like, so when they were presenting, a lot of interpretation was going on in my mind from the traditional perspective and the cultural and traditional teachings in Navajo. That's what I found was interesting about the presentation.
Okay, thank you. Thank you, Zoe. Yate, good morning. My name is Lynette Gilmore. I'm a family advocate at the Family Advocacy Center at the Fort Defiance Hospital, and this is Stephanie Perkins. She's the other advocate. We're the two very first family advocates at the Tsehoto Medical Center, and everything that the Strands talked about yesterday is what we deal with on a daily basis. We're the sexual assault unit at the Fort Defiance Hospital, and we come across trauma every day. We deal with it from 8 to 5, and then we're on call, and we get in there in the middle of the night, and we help Dr. Arnellis, our director, do exams, and we're right there with the swabs and everything. So we pack up the kits, and we, as family advocates, our jobs are also to be there for our patients. And we work with social services, strengthening families, law enforcement, and anything and every resource that we could touch on. And it's not just Diné, it's Zuni, it's Hopi. We have Apache patients. We have patients that come in from Tuba. We work res-wide, and we're the only family advocacy center on the Navajo Nation. And we just commend our supervisor, our director, Dr. Arnellis, who started Para los Niños in Albuquerque, and she was recruited to come to Fort Defiance. So she started our family advocacy center, and we were recruited to assist her. So we have a small unit, and all our patients endure, this trauma, this nightmare they're going through, and we just support them through their whole process. I just also want to thank you for everything that you presented. I feel like our law enforcement is in dire need of the FEDI training. We know that they're spread so thin. We know that they're overworked, and we know that they have their own obstacles too. But, we have obstacles with them also, and we try our best to work with them. We try our best to work with social services, who is also spread so thin. We have the Pinyon Agency, and there's only a few staff there that are able to help, and we're lucky if we get to see our patients from Pinyon, because their transportation is an issue.
You know, there's so many things, you know, that I could talk about as far as issues, but I really want to thank you. I feel like it's an honor that we have you two here, not only at this conference, but living here in Flag. We've heard so many wonderful things about you from our director, and she kept reminding us, don't forget the Strands are going to talk, don't forget. So she got us all excited, and we've even looked into your training online. We want to attend, and so our training, our director wants us to be so fit and knowledged in the field of advocacy and sexual assault. And so she says, you'll attend the FETI training, not right now, but eventually. So we're excited. And I just want to thank you so much for being here and taking this time out to present all of this, because that's what we do. That's our job. And it was an honor to listen and be a part of it. So yeah.
Okay, anyone else? Okay, I have 2 more comments.
So I want to thank the Strands for coming, and I think what stood out to me was this agency self-assessment tool, and I'm not sure if everyone got a copy of this, but it's really, I think it's a really good template for agencies to really take a look at their service delivery, to making sure that it's human-centric. So I wanted to bring that up and just kind of remind everyone that they do have this draft here, and I think it's really important to utilize as you start to look at more trauma-informed, human-centric approaches to how you're providing services to your clients. So I thought this was what really stood out to me.
So the assessment's on the website. Okay.
The other thing that I would like to add, and I understand that in the first part of this in Shiprock, that the community people were allowed some space to talk about their own experiences or their concerns related to their relatives who were missing or who had been murdered. And I think that, you know, when you start working on this, that there should also be a component that is directly related to or addresses community experiences and their concerns, and ask them, what is it that you need in terms of support at a personal level and at a community level? Because from what I'm hearing here, you know, the institutionalized efforts of report, of trying to attend to, you know, the details of getting some measure of justice or whatever it is, gets institutionalized, and there can be a sense of people feeling like they're meeting with indifference and they're not getting the kind of attention and support that they need. And so there also needs to be a community component from people themselves who say, this would be helpful to us. This is what we would like to see from families and from the community in addressing these issues. So I think that's a really important point to do.
Hi, I just want to add a little bit more about the Strands presentation. I have been an advocate for a long time now that I really believe that we as Indigenous peoples, as the Navajo people, need to begin to press upon the schools, our leaders, our families, our work environment, that we have to be given the opportunity as part of our staff development to go through training on historical trauma. It's really important, and as old as I am now, I work with a number of younger individuals, and in human rights, they don't really grasp the understanding of the historical significance of, like, the American Indian movement. That was seen as very radical. But they were the first group to establish human rights for Indigenous peoples, to remind us of where we are within all the other peoples in the United States. You know, we all go to college, we get different degrees, but they don't teach this in college, because if we're going into IT department, we're never going to learn anything about the history of our own people. So I really think it's so important that we try to take this information back and we begin to advocate with our employers that we all need a training in historical trauma. I think it's so important, and I really want to appreciate that opportunity with the Strands to provide that. I think it's a void that we really need to go back and refill.
Thank you. Okay, so we're going to wrap it up. The last thing we did yesterday was we had a recentering exercise from Teresa, and then we adjourned for the day. So today what we're going to do is we're going to have two presentations. I believe, okay, so the first, or I'm not sure what the order is, but we're going to have the Center for Health Equity Research talk about databases, and then we're also going to have the Office of the President and the Vice President give us an update. I'm going to turn it back over to Teresa. Thank you for your participation. We'll get started with the two presentations.
Thank you very much. Well, I think we're awake now, right? So with that, we'll go right into the presentation by NAU. Thank you, ladies.
Well, good morning. My name is Nikki Teufel-Schoen, and I'm the Associate Director for the Center for Health Equity Research here at NAU. And I'm here with my colleague, Ricky Camplain, who is an Assistant Professor in Health Sciences here and an epidemiologist. And in our putting together this particular presentation, our intent was to really provide some to create a kind of common understanding when we use the term database, because we've been using this term for the conference or the forum that we had in Chiprock. We've used it here, and much of the discussion today is related to this concept of a database. And I know that we all come from different disciplines and different experience, and what we think a database is and what it can and can't do, I think is important that we all get on the same page. The other thing I wanted to mention, because I was here yesterday, I really feel like some of this presentation was inspired by some of the things that were said yesterday. And in particular, I think that Dominique Rowe, Sibowitz, who talked about the databases, Zoe and Ricky and I have had a lot of email exchange around the databases that are available. And we know that they're not Navajo specific, but there are a number of databases, and they use a variety of resources to build those databases. And although they use a lot of different sources, that can be also a deficit in terms of how you are able to compare the information that is in different data sources. And the other thing I wanted to mention before I hand over the microphone to Ricky, who is really the powerhouse in this presentation. I want you to know that. I kind of pushed to Ricky. We really need an epidemiologist helping us here. Somebody said yesterday, or I wrote in my notes, which are crazy, that in this context, the lack of data and our ability to manage and understand the trends in that data really has the effect of continuing the disempowerment of colonialism. And I think I really drew that from Dr. Diné's presentation, this idea of the wide-reaching impact of colonialism. And unfortunately, we've all heard when we mention this situation of murdered and missing Diné relatives, that, well, where's the data? What do we know about the trends? Is it happening on reservation? Is it happening off reservation? And not having a good command of that data is a continuation of the oppression of colonialism. So with that, I'm going to hand over to Ricky, who's going to walk through some of these really basic terms and have us hopefully get on a common understanding of what we can do and what we can't do.
Thanks, Nikki. So I'm Ricky. Yes, we should have our own sitcom, Nikki and Ricky. But So I am humbled and very much excited to be here in the presence of all of you and your knowledge. I've learned most of my base knowledge about murdered and missing Diné relatives from these forums, so thank you. But one thing I do know a little bit about is data, so I hope that this helps everyone kind of get on the same page, but also realize that the potentials of data and how it can really help, but also the limitations as well and what it can't do. So I broke it. Did I step on something? Oh, okay. Of course. We're off to a good start. Thank you. Thank you, Zoe. So a database in its just kind of basic space is a system for organizing data. It's where you can drop data, collect data, enter data, and it's really a tool that can be used to determine the extent of a problem. So in this case, the murdered and missing Diné relatives. One thing it also can do, with the right information, it can detect patterns that can inform action or intervention. And I think there are a lot of ways, and Nikki touched on this when she started, that it can really support this MMDR effort. All right. So a huge part of a database is who ends up in this database. So who are we putting in? What's a case? So a case is all the available information on a particular victim. So human trafficking, sexual abuse, those are all different definitions of someone who could be in the database. And I think really the criteria of a case, particularly for MMDR, and really needs to be defined. And that could be in a group of people, in a working group. But once the criteria for a case is met, the variables to describe the elements of the case need to be identified. So the next slide is about variables. So what exactly is a variable? There are a lot of terms for this, metadata. Variables is the one I use, it's a little easier. And it's just really information about the case. So a person who is in our database. So examples of variables include gender, were they male, female, transgender, non-binary, age, and also another example is the community they were last seen in. So that could also be more detailed, like an address, a specific place, maybe a place of business or a home. But really thinking about the variables, the analysis of a variable can really help identify those patterns I was talking about in the first slide. So a good example is, do victims fall in a particular age group? Are they younger, are they older, or are they all different ages? We also can talk about the communities that they were last seen. Was it on the reservation? Was it off the reservation? Was it in border towns? Those are important things because we think of where we concentrate efforts, and if we want to concentrate efforts in the appropriate places, we need to know this information. There are also different types of variables, quantitative versus qualitative variables. So when I think of quantitative, they're really like categories. So the community last seen, so you could say Tuba City, Fort Defiance, and then you can also further categorize that into something like on and off the reservation. Age, gender, these are very concrete information that's pretty easily digestible. And when we think of a qualitative variable, there was a very good example, and I can't remember the database that Zoe sent us, but it was a last seen details. So these were sentences and thoughts strung together. But when it comes to last seen details, something like they were seen with so-and-so in a vehicle leaving Fort Defiance, for example. Those require a really systematic use of coding to determine these types of trends or things we want to know about. So were they with people? Did they get in a car? what was the car type. I mean, really, this can get at a lot of details, but you can get bogged down into those details sometimes, and it can be overwhelming to find those trends or patterns. So continuing on with variables, it's really important to think about integrating quantitative and qualitative variables, and it can contribute to a really nice comprehensive picture of maybe that particular case, that person. Since the analysis of variables does actually yield patterns, so when we analyze these things, these variables should be discussed thoroughly and adequately, and what needs to be put in there. And if you think about it, so too few variables, so if we only have a few, couple, age and sex or something like that, it can prevent the observation of patterns. So we won't get to know enough details. But too many variables really can be overwhelming, it's bogging you down, and it might actually create noise, and some sort of particular patterns in our data would be very hard to detect. This is from yesterday, from the woman from ASU, and I'm just going to reiterate this. It's really important to remember to have standard variable definitions, to really look at valid patterns. So when you pull data from different places, they might have a different definition of community last seen or other things. So really trying to think about where we're getting that data and if it's standard across all the places we're getting it and how that might differ. Another thing, thinking about this information that we want to get for the database, it's really important to find out who has this information. So police, victim advocacy, social service, hospitals. So who has it, and really where can we obtain it? Then we have for information from social media with the Facebook group, which is a lot of work and so important. But we have to make sure that it's valid and the information can be verified, because if someone can put that information out, we have to make sure it's real and true. And we also have to see if the source of the information can be coded in a particular variable. So when thinking about databases, it's great to collect data, but we have to do something with it. It's really important to think about that. So we want to be able to have people with specific skills to look at these trends, to look at these patterns. So really verifying the quality of data, so why data quality is really critical to inform action, because we want it to be real, we want it to be true, and we want it to be valid. And we need someone to have those skills to determine whether it is or not. Data management is a whole other skill set. And it really thinking about integrating these qualitative and quantitative data variables. And then we also think of data manipulation, and so analyzing the data. So really finding those trends and making sense of what it's telling us. And I'm going to hand security and protection of data to Nikki.
So I think one of our objectives here is trying to think through what kind of work group or people we need to help figure out what the criteria would look like, the inclusion, like some of the things that Ricky was saying in terms of, we need to define what is considered a case that would go in the database. So it's going to take some hard thinking about, how did the other databases perform, or how do they function? What a database that might be collecting data about murdered and missing Diné relatives, how could it look different so that it is able to provide the information that we're thinking can inform action, whether that's action in terms of how investigations occur, how policies are developed. And so the idea of really starting to get to that level of really thinking hard questions about what a database would look like. The other thing that is critical, and I know most of my work is around health issues, and so I do work oftentimes with Indian Health Service, and we're looking at electronic medical records. And one of the things I've learned from that experience, and many of you who have also interacted or worked for Indian Health Service know, there's a lot of emphasis on the security and the protection of the data. So that kind of an approach is going to be critical if there's a relationship developed with Indian Health Service about individuals who present at healthcare facilities, and that it is detected by the provider or in an exam that the person has been involved in a trafficking situation. We've heard that, I think we heard it from the conference in Shiprock, that unfortunately nationally we know that a lot of sex trafficked victims actually do end up having an interaction with the healthcare system. And the idea of having providers having better skills to detect that and strategies for actually getting a victim away from their traffickers. How can you do that in a medical situation? But if we're going to partner with or if the database managers or development are going to partner with Indian Health Service, the database has to have the credibility, because Indian Health Service is not going to be involved in any kind of shared data relationship unless we can demonstrate that. The same is true of federal, state, and tribal law enforcement. We've been having representatives from the city of Flagstaff, tribal law enforcement, and the idea of sharing data, using some of their data sources to enrich a database. Again, there really has to be this, not only the credibility of security of the data, but also protection of the information that's in there, because people's names are in there in a variety of ways, whether they are the victim themselves or the victim was last seen with a certain person. That has tremendous implications in terms of protection of the people in the database. So I'm really concerned sometimes when I see these databases that are publicly available online, and I know that the intent of doing that is to kind of get the information out there so people can help in terms of the locating the individual. But we have to think, what's the intent of a database that might come out of these collaborations and the protection of the data in there. Court systems, same thing, and all of this is going to require some kind of memorandum of understanding between multiple agencies about how we would share data. So I just think that's another level of us to be thinking about when we think about the sources, how we manage, what the variables would be, and this will be another level of things that we have to think about. And again, really the criteria is, or the intent is to protect and really hold this data sacred. We heard that frequently in Shiprock about the sacredness, and I think Sovereign Bodies has done an incredible job in terms of thinking about how sacred this information is. And I think we need to also be thinking about how then we keep it protected so that we're not re-traumatizing family members who may see this online, and there's just this whole other level of protection I think that we need to be sure we address. And I think that's the last one. Yeah, okay, great. So this was intended very generally, but I don't know if you have any questions for either myself or Ricky, or if you have comments.
Thank you for the presentation. What's the possibility of our people at our home level? I have trouble with the word community because I still don't know what it is. Where we can come together and establish our own family database, or like who's within our clan, who's within like what they call like for family reunion. People do that. They know who from different groups, and then the reason they have family reunions because they feel like they're getting out of touch and they're not sure, and they want everybody to come back together, and they do this by clans from the mother's side. And I'm just thinking if we were able to take that approach where we know where our relatives are, who our relatives are, and when one of our relatives is missing, then we would all be alerted. we would all know some way, somehow, informally, because that was, I think, the intent of being a Klan member, which is whenever a new birth of a child, that child was welcome through a ceremony, and then also when the first laugh and so forth, and etc., as the child grows up. And so this might be more unique to certain areas of the Navajo Nation where people are still practicing and are strong in their traditional cultural ways. But it may not, and not everybody would want to do that. Or establish through the Navajo Department of Health where we have our own birth certificates that show our clans and show what family, who our Chays or Masanis are, our Nallis, etc., to the extent that we really do know. Because some people would say, I don't know my dad, or I don't know my Nallis, I've never met them, etc. So this would be to help ourselves, basically. And that was all informal. That was not done written except through the, I think, the Catholic Church when they started with baptism, and then marriages, etc. So they have that information as well. To me, it's kind of too late when families get together at funerals, planning. There's a planning meeting for a funeral. It's, in a way, you still celebrate the life, but yet you didn't enjoy that person's life when they were here. So I think in retrospect, I think there might be a way to where that might be seen as part of our own wellness, our recognition at our level, our family level, our clan level, and help us to be able to get back in touch with our Diné relatives. I just have this burning question. I hope someone here can answer my question. Where was the old Flagstaff powwow held here? Fort Tuthill, that way? Oh, is there still a remnant of that place, or is it all gone? Oh, okay, all right. Oh. So this would be like 1950, 56, 57 is what I'm talking about. Yeah, that was Flagstaff dorms. Okay. All right, just wondering about when our people used to come here a lot, and that was all. That was the question. Thank you.
I mean, I think the key in Carol, right? What Carol said is that we should be thinking very comprehensively and out of the box when we think about what a database that would serve this effort would look like. I don't think there's not a template out there that's maybe perfect for our needs, and so I think really thinking broadly about what could that database have that would really help give direction to how we want to move. Did you have a comment?
Thank you. My question is, since what you talked about, the reluctancy of the law enforcement judicial systems not wanting protecting their data they have stored, and then also, and then from my work too, I work for Indian Health Services. Almost it seems that every other week there's a HIPAA training that we have to take every time. So, what you two as an expertise, what would a community member, what do we have to do? I know do we advocate to the legislature, the tribal government, the state government, and then at the federal government level? Oh, do you know of anything that might work for the common person to see what we're trying to establish as far as sharing data?
I wish I had a really great answer. I think we do have to learn from the one example that you and I are familiar with, which is how Indian Health Service protects their data. And I, being a non-IHS person, have worked with Indian Health Service, and I too have to then go through those trainings if I want to look at that data. And I agree that there are a lot of HIPAA trainings, and there are a lot of security procedures and protocols that we need to follow. You know, I don't really know the answer to the question. It sounds like certainly within the Navajo Nation, it would seem to be, there would need to be a discussion of the data that is currently owned by the Navajo Nation, whether it's law enforcement, whether it's court, whether it's social services, that right now there's no mechanism for all those databases to talk to each other. And how can that happen? And that seems like it's a council level decision. But I don't, you know, I'm just sort of thinking from my own more limited experience.
So at the last forum, I know we had a really great presentation from the Sovereign Bodies Institute. So I think relating to getting access to the data and not just relying on, you know, IHS or PD or whatnot, how do we create our own tool to start collecting our own data? How to, like, you know, what's that gonna look like? And I think that's an idea I think we should all keep in mind as we develop this framework for the database, is how can we create our own data collecting tool, the stories from the families, and then looking at like how we protect that. So I think, you know, like SBI's model is amazing, but it also encourages like, you know, self-determination, autonomy over the data, and just basically, you know, more from like a grassroots, you know, level. So that's kind of what I remember from the last forum.
You have to talk in the microphone because it's being streamed.
Thinking about what Nikki said in the last slide about memorandums of understanding is really establishing that relationship. It's kind of like coming in and saying, we're not going to use this for a bad reason. We want to help your side, and we want your side to help our side. So really coming at it from a place of mutual understanding and having, I hate to say, you know, contracts, because that's what a memorandum of understanding is, but being on the same page and having that and pushing for that and allowing your institution, IHS, or someone from the court systems or policing, and advocating for them to do that sharing and saying, we're using this for a good reason.
Well, I'm walking back here. What is your understanding of the source of Sovereign Bodies data? Mostly Facebook and online sources? Is that your understanding?
So they did look at, you know, data information that they were able to pull from state and federal agencies, but they created like, and there's another tribe that in Washington that actually has a portal. So families who are okay with sharing their information, they go to this website portal, they enter the loved one's information and all of those variables that you had up there, and then it goes into their database and they go through it. But a part of that is coupled with them also the other part of that team are acting as advocates. So they would take that missing persons report because, you know, some of these families were like, well, we've already went to police, you know, we went to law enforcement, we're not getting any follow-up. So they're sort of like the voice for them. So while collecting the data, it's coupled with actually advocating for them and going to those agencies and saying, we got this report, you know, it's been so many years, so many months, so many weeks, we want to get a follow-up. So I mean, I think that would be something for us to consider, is also creating that sort of portal as we collect it, and it's anonymous, or if they feel comfortable sharing it with us. So that's one option that they talked about.
I think, well, you moved. I was headed back in that corner, and you're up here now.
I'm Christine Benally, for those of you who don't know me. I'll give you a little bit of history. I'm from South Nasty. That's one of the communities that Amber Crowd is representing were her constituents. So when she first got into office, I shared with her our own family dilemma. We have a perpetrator in our family, and just the disruption or the fear, safety issues that he was causing our family. So I said, we need help. And we've gone through all the hoops of law, social services, courts, and all that, and it's very traumatizing. So her, as our legislature now, I said, we need help. And so she asked me to present before the HESI committee. So we did, and Jonathan Hale at the time said, give us a draft resolution of what we need. So that's when we started collecting recommendations, and from communities, from victims, from advocates, from law enforcement, from attorneys, from educators, whoever would provide some sort of recommendation in their issues. So that's a live document that I've been circulating. We've got support for resolutions from several chapters, several districts, and all the 5 agencies, the Hatali Association, the Medicine Men Association. The most recent one that came in was the Utah Health, and I've asked Tuba City to support it as well. And so anyway, to make a long story short, she put together this sexual assault work task force, and Jolene was working for her at the time. So we started meeting 4 years ago, and human trafficking became part of that discussion in that task force. So there is already a resolution that was passed by the Navajo Council in 1992, I believe, to share data. So that's existing, and it's a valid resolution for all tribal programs programmatically to share data, but it's not happening. Some of the people say, well, it's old, but it's still live, but that's not happening. And I've, in any public health crises, as sexual assault, child sexual abuse, and human trafficking is, if there is a plague, everybody jumps on the bandwagon. And so I've requested the nation to announce this as a public health crisis so that information can be shared, not withholding anything. So if there's a plague case, okay, information is shared. And so going from that angle, and I think that's the protection of the data, the reportability, the analysis, it would all be forthcoming. And at that point, when there's those investigations, there's the jurisdiction, the sovereignty is all put aside, because this happens on a daily basis. Cases are reported to the state that get shared to national. If a child is born, if a person dies, all that information goes into CDC. And so I think that why are we building this database? And that's, once we get that, and what do we expect the outcome to be, that should frame the database. So is the objective to find these individuals? I would think that that is it. So what information do we need to find these individuals? Just like any public health case, what information would we need to get a certain disease under control? So I think that's the angle that maybe we should approach this, is, well, there are missing relatives, are missing family members, so the variables that we will be collecting, I think, would be from that framework. So again, as a researcher, you would want to know what outcome do you want? And then that's how you would frame the database. Yeah, collecting information can run away from you, and then after that, how would you control it? As any public health surveillance would be.
Thank you. So onward and forward, we have these posters available over here. So if you would like a copy of the poster, you're more than welcome to take one or two. So please sign in, and you can take one or two of the posters. However, if you are with an agency or an organization, please talk to the organization that has these available for us, so that perhaps a discussion could ensue regarding more copies. So you're more than welcome to it. They're all sitting right there, so you can take a look at that. So next, we're going to move on to the facilitated discussion by Navajo Area Indian Health Services. Please come on up. Continuation of the development of the MMDR Data Institute framework. So, I'm sorry, we have Navajo Nation Office of the President and Vice President here that's going to also provide some input and presentation, right? No? Okay. Okay, cool. So we'll go ahead and give them the floor.
Yat she Sarah Woody Jackson Yanishia, Tulij Eatney Nishlan, Tutsoni Bashishin, Sanjakina Dashachedo, Tapahan Dashanella. I come from Winter Rock, Arizona. I have, in St. Michael's, I've lived there all my life. But my family, my clan, Tulij Eatney, they're from the Forest Lake area. And my grandmother, she ended up moving out to Greasewood, Lower Greasewood, Arizona with my grandfather, and that's where they have their home. And that's where I grew up as well when I was very young. And my Nollies, they're from Steamboat, Arizona, and I just want to acknowledge them in that way because of them, it's, I am who I am. Both my grandparents and my Nollies, and to this day, I'm very fortunate. I am 32. I'll be 33, I think. I don't remember. But I'm very fortunate to still have both my Nollies and both my grandparents still alive with me. I've been very privileged in that way, and so I do my best to recognize them everywhere I go. And then my parents are Royetta and Clifford Woody from St. Michael's, and they have a home there as well. And I'm just very thankful that I have both my families, and we've come from one home. And the background that I have is I didn't really grow up traditionally. I do have some traditional teachings and traditional values, but my faith was always within the Native American church, and that still encompasses a lot of traditional teachings, not only from my people but from Native Americans across the country, and so we're very spiritual in that way. And so I just wanted to bring that up. And I do have a husband. We have a beautiful little girl. Her name is Briseis Jackson, and she's just the love of my life. And I work with the Office of the President and Vice President. My husband and I had came home about 2 years ago, and he had just got out of the military, and we were both looking for jobs at that time. And I had just finished my degree, and I was looking for something. And everywhere I went, you don't have experience, and you don't have enough this, enough that. But I ended up turning in my resume with the Office of the President and Vice President, and they were only able to bring me on as an intern. And I really just kind of migrated towards the Vice President's office at that time when President Nez was the Vice President. And so during that time, I worked with his office a lot. And over time, he saw what I was capable of doing, what knowledge I brought to the table, and it just so happens that there was an opening under his office, and he brought me on as an executive staff assistant. So I've been with him for a good year and a half, myself and the two other staff that are still currently with him. So I'm very thankful that he brought me on again under his new administration. And he had asked me to take on a lot of the projects for mental and behavioral health, social services, and veterans. Like I said, my husband was in the military. He was a Marine for 10 years, and so the administrative knowledge that he had, I picked that up, and I was able to help several of the veterans that came into our office. And my background is in social work and psychology, so that was why I really took to these individuals here, to their presentation. Everything that they were talking about is everything that I believe in, the trauma, how we have to take care of ourselves in that way. And so right now, I'm currently assigned to the Office of the First and Second Lady, so I really handle a lot of their scheduling and a lot of their priorities that they're doing. So some of my projects have been kind of pushed aside, but right now they are currently interviewing for somebody, so hopefully they'll bring someone on soon and I can get back to my projects. But I've enjoyed my time with them, and they bring a lot to the table, and I'm very thankful that we have these women in our office, because seeing them out in the field, seeing what they would bring out from their home, from their experience, is very beautiful, and I'm just so thankful that I have been a part of that with them. And so some of the priorities that under this Nez Leiser administration, maybe you're familiar with them, maybe you're not, but Mr. Nez and Mr. Leiser are very humble people, and their priorities came from the people during the campaign trail. They've listened to the communities out there. I believe we visited over 60 communities, and it was a lot. It was a lot just being out there, but it was a very wonderful experience, because we got to know people from there. We got to hear their stories. We got to get to know them on a different level rather than just, them being there. And so that's how mental health, family prayer, and public safety were kind of put on my plate, because that was what we were hearing from the public. And so under that, we've had there's so much we've been doing the last seven months now. And so we've established several work groups within the office, and the most recent work group that Mr. Nez had established is the Reuniting Diné Relatives work group. And so we have several staff within our office that are working together to help combat these social ills that are on our nation. And we're working with the various divisions, the various programs that we have to better have services provided for our people. And it's a lot of work, and I'm very thankful that we have a majority of our public that are very patient with us. And I know when we say we're going to get into the office, they want change, they want it immediately, but sometimes it's not always like that. But we're getting there, we're working on it, we're working towards that goal. And it's not only just for this administration. What we're working towards is going to affect the next administration, the administration after that, and then our children. That's why we're all here, is to make something better for our children that were coming home. And so we are also working with the Division of Social Services, and I've had many conversations with Christine and Dr. Diné Dale while I've been here with you guys since yesterday, just about the little things that we're doing. There's a lot of stuff that were brought up earlier, was that we're stretched so thin with police officers and social workers, and that is very, very true. But on the positive note, we have been recruiting a lot more officers, and I believe there are about 20, don't quote me on this, but I believe there's about 20 officers that are going to be graduating soon again. So we'll have that much more bodies out there protecting our people. And so one of the things that we're working on with Back to Social Services is that we're doing a strategic planning session with them. And that was one of the biggest issues was brought up, was social workers. We don't have enough social workers. And those that do come home, the younger ones, they only stay for about a year or less, and then they leave. They leave somewhere else, or they go to a different program. And that's just the one thing that we were like, why is that happening? Why are we not being able to retain all of these young people here? And it's because we are the social workers that have been there for a while have their own way of doing things. And so what we're trying to do is trying to change it up. And some of them are scared to do it, some of them are excited to do it, and some of them are just like, well, we've done it already. We've asked for these things to change. We've asked for all of this to be different, but nothing has happened. And so we're working now, and I'm very thankful that we have a division director, Miss Deanna Neswood-Gishi, and she's been there. She's been with the program with social services for, 20 years, I think she said. And so she knows the ins and outs of what needs to be done, and now she's in a position to where, finally I can do something. And so she has that experience to help us with this change. So I'm very excited to have her with us. And on top of that, with public safety, they're establishing a missing persons unit. We've been working on that for a while, and we're getting all the stuff that needs to be done, budgets, positions that needs to be put in place for that. So that's what we're working on. And all of this came into play because we've met the missing Navajo Missing Persons Unit, the Facebook group that had presented yesterday. Miski, we met her, about a year and a half ago, I think, and we've been having monthly meetings with her, and it's all because of her. All of this is because of the advocacy that she has brought, the awareness that she has brought, not just for those that are missing, but for the families. The families are the ones that are hurting, and I'm just very thankful that she's still that strong voice for them. And I know we've been haven't been able to meet with her group for a while, and it was because we wanted a division director from Social Services, Public Safety, and Department of Health to all come together to be there from the beginning this time around. I know that when we first met with her, that wasn't really the case. So this time around, we're trying to start from the beginning. And it took a while for us to fill that social services division director. So we're coming full circle, and we do have our next meeting coming up. And I'm very happy that we're going to be doing this again. Having those monthly meetings with them, with that group, because the way I see it is that we're not going to get anything done until we hear from them, from the families, what they need, what their wants are. And so I'm very thankful that they've been patient with us to get this together for them. On top of that, I'm not sure you have heard, but both Arizona and New Mexico, they're both starting a missing murdered Indigenous Women Task Force group. And so we're working with the state to make sure that we have a representative from our communities, a Navajo representative, and we were recommending the first and second lady to take on that role. And so we haven't gotten confirmation of any appointment yet, but we're just very thankful that those groups are being established. And then just to kind of go back on the highlights from yesterday, I really, really am so thankful for the group that we have, Delegate Crotty's group, Ms. Holgate over there too, and her team that we have here. They've been so dedicated to everything that you are listening in on, the presentations that they have provided, the forums that they're putting together. They have been doing such a great job, and I'm very thankful that they continue to do this on their own time. When, late at night, they're always volunteering to do something. So I just want to say a hat to that group, and for always including the Office of the President and Vice President. I really appreciate that. And then one of the highlights too that I really enjoyed from yesterday was it goes back to the strands for the presentations. Thank you so much for that, because you are right. Trauma is something that we're so immune to sometimes. We're so desensitized to it. We don't know how to approach it. And I see that even with myself. I'll admit that there are times where I come to work and we have a constituent coming in, and I'm just like, I saw you just last month, like, what's going on? And I don't want to feel that way. And so just, listening to your presentation made me reevaluate how I need to approach my job and how I need to approach my constituents. So thank you for that. And, for everyone here, we know that, there are circumstances of why our people go missing. And it's because they don't feel safe at home. They don't have that support system. And so I'm really glad that we are presenting that this is a community effort. We can't just rely on the higher offices to do something, because it really starts with you. It starts with everyone at the grassroots level, because you guys are there. You guys know firsthand experience how to approach these things, and all we can do is just give you the resources to help you cope with what you're going through. And so I'm just very thankful for everyone to be here. And one of the things that was just brought up today, is it Carol? Carol? Yes, thank you for what you mentioned about, how our communities can better identify with each other through care, because that's very true. And so when you were talking about that, I'm not sure if the missing persons or any of those groups that do these flyers have done this or thought about this or what, but maybe it's time that on these missing persons flyers, whoever, Native American with their Navajo, Zuni, Pueblo or Hopi, we all have a clan. We're all given our mother's clan, and maybe that's something we can start incorporating on our flyers, because that's how we identify it. That's how we identify with each other. And so if we're able to put our clans on those flyers, like that Twitch Eatney lady, that's my sister, that's my mom. And so maybe then I or you will be more engaged to providing or sharing those flyers and getting involved. So maybe that's something we can take a look at, and I'll bring that up when we meet with the missing persons group. If the families are comfortable with doing that, we can start putting their clan on those flyers. Because this is an epidemic that is just skyrocketing for so long. But anyway, I just wanted to let you know that I'm here. I was here all day yesterday, and I've enjoyed all the presentations that were said, and I don't want to take up too much of your time. This is the first time I'm actually rambling. Usually I'm like, okay, hello, I'm done. But thank you so much for being here. I'm really, really thankful that you guys have taken this time out of your day to be here and to listen and to just to be that next change and that we need. So thank you very much.
Oh, yeah. I did read that the second lady, Mrs. Lizer, was the candidate that is supposed to be recommended to the task force, so the state task force. So thank you very much from the Navajo Nation Office of the President and Vice President. It's an honor, and it's appreciated that they have a seat at the table and that they are going to continue to be involved in this effort. Yeah. So with that, we'll go into Navajo Area Indian Health Services.
Okay, the first thing we're going to do is we're going to take a break. It's been a long morning, so let's everybody go ahead and take a 15-minute break. Yes? Okay, cool. And there's still snacks over here. I believe the coffee's all gone, but there's still decaf, and there's tea. I know, I'm just kidding. I was trying to make it sound all cool. There's decaf, guys. So take your break. I don't know how to turn this guy on. Just put it down? I'm just going to leave it there. Okay. All right, so I'm going to go ahead and give you like a quick recap of some of the stuff we discussed at the Forum 1 in Shiprock. Those of you that were there, you remember it was really hot in there, right? It's not as hot here. So I'm just imagine that you're really hot. No, I'm just kidding. So we talked about, that was on June 28, 2019. It was at Shiprock at Diné College Auditorium. So we talked about what have you heard and observed in the last day and a half of we kind of had a recap of this. So we had heard community toolkit from MMDR, conversation starts at home. We're glad that the LGBTQ I2S are included. So I can't see close up anymore. I guess it's a thing. You know, your lens gets hard, and your eyes don't like adjust like they used to. Nobody told me that it happens overnight. I didn't know that, you know. Nobody prepared me. I like went to bed and it was all cool. I could see everything small. Next morning I woke up, couldn't see anything small. So now I'm all like, so forgive me. So we talked about missing and a transition between missing and murdered Indigenous women to missing and murdered Diné relatives. Are we going to operate in a sector or a silo? Is the information going to create a program, data barriers, restrictions, and approvals, needs, no specific department for family support services, data sovereignty, MMWI to MMDR, amazed at the SBI, the Sovereign Bodies Institute, Gallup and Farmington. Discussion should extend to metro areas, confidentiality concerns with the data, HIPAA, etc. Who is the point of contact? How would the remains of relatives be handled? Unidentified, cremated, etc. Barriers, getting approvals from the Navajo Nation, peacemaking, Diné language, frame in the context of healing, stories, not just data, how other types of trauma intersect with MMDR, racial justice, system changes, gender, not just a male-female issue, responsibility of poor choices. How much more will it take for the community to open their eyes? We need the entire community involved. Be aware of your surroundings, social media, who we talk to, etc. No specific department, should be everywhere and not just on the Navajo Nation. Law enforcement, prosecution are beyond capacity. First responders are also susceptible to vicarious trauma. Understand trauma and be trauma informed, understand dynamics, asking questions and learning other data collection methods. Stand-alone advocates benefit as they are more victim and human-centric. Waterfall slides to look at different data and frame data. Include all unattended deaths. Form a team to look at trends and misclassifications. Educate what's behind behaviors, risk, impact of pornography, interpersonal violence, influence how we view people in terms of dehumanization, mandate external entities to provide data, example, cities, municipalities, counties, states, report to tribal entities, understand erasure, legal versus justice system, apply a system theory. Do we have the technical capacity? Ownership of being responsible to inquiries. Define human trafficking as it applies to Navajo. What needs to be collected and build our analytic capacity. Encourage public health groups to be involved. Layout or assumptions. Perceptions, how we process and understand, and having honest discussions to label it as it is. Gender, a unified understanding as it relates to Navajo. Educating our Navajo elders on LGBTQI. Nadlehe, traditionally a holy being who could change to confuse the monsters. Nadle, noun, gay men and gay women. Influence of Western culture affects Navajo fundamental understanding. Historically, Nagle helped families in several capacities. Grieving process of families and how do we support them. Something on the Navajo Nation to focus on resources currently available, data, statistics, cultural competencies, language, culture, values, providing opportunities to learn and how to live in Hojan. Create healing spaces to guide and understand. Those are some of the things we talked about initially in our initial discussion. And then we did a SWOT analysis, so we talked about strengths, So some of the strengths that we identified as a group are that we are all gathered at the MMDR forum. This is becoming a data set. Data is being collected. Momentum, forum working group, Navajo Nation Institutional Review Board, that would be a strength. Diverse multidisciplinary input, increased intelligence in the room. Subject matter experts and professional resources, honest conversations, cultural teachings, acknowledging struggles of Diné LGBTQI relatives, concrete support for the Institute and work group, human-centered approach, healing as outcome, personal investment, commitment, and ownership, basic understanding of what needs to happen, aspects and appropriate representations, hoping for positive outcomes of missing persons and outcomes, sense of consensus, perseverance and commitment, establishing collaborative expectations, create an environment of learning and openness. And then weaknesses that we identified were feedback and flexibility, no department or tribal level for families to go to for support, people feeling like they are being left out, data sources are fragmented and difficult to link, public attitude or assumptions that nothing is going on, hoarding data, no policy for data sharing, what is the focus, what to do with it, prevention, money, language continues to blame others, challenges of accepting MMDR as epidemic, continue to lean towards working in silos. Will this lead to prevention, mental health facilities? Who is doing the actual work? Who has buy-in? Technology and infrastructure? Who controls the funding and finances? Slow response to communication inquiries, jurisdictional issues, policies prohibiting sharing, and just fall in line attitude. How will data be protected? Do not want to be used for research. Navajo Nation IRB could be a strength, acknowledging that we are all relatives, learning about effects of lateral violence, victim blaming, and slut shaming. HIPPA, HIPAA, opening for resources, treatment centers, hospitals, law enforcement, MOUs, MOAs, resources for families with missing loved ones. And then opportunities that we identified, opportunities to empower people, opportunities to work with tribal epidemiology centers, have experience with data collaboration and access to more data sets, train tribal communities to analyze their own data, framework used in other health fields, template to protect, give voice and dignity to families, solve cases, and hold institutional accountable, use data to solve and prevent mental health issues, mobilize key local points, review and question Navajo law enforcement to align legal justice systems and funding. And then threats, data sovereignty. Perpetuate cycle for families experiencing this is a crisis, don't want to acknowledge, family not wanting to participate, a lack of mobilization showing cultural protocols, possibility of inaction, no response, how will this benefit the people, outcome benefit, re-traumatization of families, leadership lack of awareness around issue, false perception of service providers, police, social services instead of coming up with solutions, not wanting to make it easier for abusers to find victims, how to balance, keep safe versus connect, a phenomena of need to keep secrets, refusal to take actions, perpetuation of loss of dignity and voice, co-opting this movement, entities wanting to access data and funds, border town police internal accountability, and what does relationship look like, underreported or missing data. So after we talked about the strengths, the weaknesses, opportunities, and threats, we did a brainstorm. We brainstormed ideas of how we could, of what things could happen, what things needed to happen in order to create this data institute, to work towards this data institute, have a shared vision towards the data institute. And after we brainstormed, we kind of clustered some of these ideas, and we came up with this, this guy, why do you keep jumping over? We came up with this framework, and I'm kind of sad that Moroni's not here. He explained it very well. And so he basically what we decided was that collaboration and communication were some of the keys that we needed to start with. And these are actually underlying everything here. Okay, and The spirituality, cultural, sustained infrastructure, traditionally tailored foundation, implement an indigenous data sovereign framework, these feed into this, and then these feed into that. But I guess all these underlie the entire thing. So that's kind of like the support for the whole concept, the whole idea, the whole program. And then from this, we get leadership comprised of grandmothers and matriarchs, a comprehensive for risk analysis, and then research analysis. And from these, we get break the cycle, interruption of missing, murdered relatives to actually prevent it from happening. We have positive outcomes through holistic healing. We have endures administrative change. Sorry about my typo. And then we also have funding. So that's kind of what we came up as a group last time. Okay, so thinking about that, all the stuff that you just heard, thinking about all the stuff that you heard yesterday and this morning, the presentations that we had that we talked about earlier this morning, and the two that we just had a little while ago. I want you to keep those in mind as we're moving forward. So we are going to move to this side. If you want to change your chairs this way, that'd be cool. Can you tall person?
So we'll be needing you all to participate.
I'm too short. There you go. Woohoo! Yes. Okay, so we're just gonna go ahead and change our chairs. And you can make it like a semicircle if you would like. You can turn them like in a circle if you would like. Okay, is everybody settled? Okay, cool. All right, so some of our givens is what? We want to create the Missing and Murdered Diné Relatives Data Institute. Who? Navajo Nation, communities, programs, legislature, and Navajo, non-Navajo partners. Where? Navajo Nation and border town communities. And then when? So one of the things that we did is we actually created a very specific timeline for this. So what we want to do is we want to have something put together by October 2019 so that we can actually, Delegate Crotty can actually create a proposal to get some funding to actually start something. So we want to have our very first step towards this bigger picture that we just talked about. All the stuff that we've been talking about at these last two forums. So that's what we want to work towards. We want to take our very first step by October 2019. All right, and so now I'm going to turn it over to Randy. You can introduce yourself, and you're going to do the vision. Or no, the victory.
The victory. Nana. Hela to waha yalt the nosenshi I don't think it holds either the nosenshi de. You probably thought, who's that guy talking, asking questions and all that? He didn't even introduce himself. He's talking about and all that stuff. It did been yat ishik in there. Sani do has tweetos Jaketo Jaketa. Yat eshe yahat hudich in the shle. Slashik eden no sleto Dana hints data source to my relatives. Aros Zabashim, Nakidin Edashinaldo, but Anita Che. Randy John, Edashin, Indian Health Service, Panash, store, environmental health charge, and not public health advisors. No, Benin public health advisor, the Nishin edition, and the Shislag, Hati Yanigi, Ishbinin, Nachidi, Heleta, Mika, what I know she. You know, from my previous experience, I was a police officer for 21 years, And then also I worked a lot with community-oriented policing, with those type of programs. So I'm a retired policeman. So ayuhashi salabahana ayun nan satta ako yat eho ako do you want him to introduce him, the facilitation team? You introduce you that.
Hi, good morning, everyone. Shay Kirby Gainshia, Hashkahathon Shlant, Toheglini Bashichin, Nashkala Ishachedo, Glasche Ishanella. I am originally from Chinle, but I currently reside in St. Michael's, just outside of Winter Rock. I currently work as the Director of Training and Technical Assistance for the Southwest Indigenous Women's Coalition. We are the statewide coalition, tribal coalition funded to work with all 22 tribes in Arizona, providing education, training, technical assistance, community mobilization, and policy support in the areas of domestic violence, sexual assault, trafficking, teen dating violence, and stalking. And now we're starting to include and fold in the topic of MMIWG. So we're definitely trying to be at the cutting edge of working with tribes in terms of what their current needs are in regards to these top 5 topic areas. And so that's why we partnered here with Delegate Crowdy and Jolene to really just be able to lend our support in the efforts here and see how we can mobilize the Navajo Nation to be at the forefront of MMIW. And so that's what we're here today. So I'm excited to facilitate this next process. Carol.
Yeah, honey, so she Carol Leonard, Dasha Janito, Toyet Lininche, Aro Totsoni Bashichin, the Bathajan, Dasha Chedo, kill the Chili Dational, look at Jika Holiare, Shache Eya, Hastin Kutlak Liene, Eya Lupton, Naranda. Aro Eya has Twisla Eya, Mr. Rithouse, the Bajinine, Willie Rithouse, Tratin Law, Eben Natchet, Nisha dozen. Aro, for those of you that are from Mukajigay or in the area, I'm from the west side Leonards. So there's north side, east side, and south side. So we're closest to the Round Rock area. And I work with Dr. McKenzie and Mr. Shiaj. Randy from Shiprock, and I guess we got reacquainted from working together previously. And as part of the facilitation team, I work for Indian Health Service right now and health promotion, disease prevention. Thank you.
Oh, it's not Ani Nezon Asham from Shiprock. Shashine Yaki Ani that Sado Shasai Yaha Karen. John, yeah, that should be Donaldson. Karen Sandoval, the Sandoval, Andy. Ako, out of that, she get Yaha First Nations Janadnish in Albuquerque. He's a community health worker, Randy John Jr., yeah. He got his degree in financial management. She should get financial management, yeah, guess what he's doing now? He's a community health worker for, he's in public health. I guess the chief executive officer asked him when he was getting hired, she goes, how come you want to be in public health and you have a degree in financial management? And then he goes, my mom is a registered nurse, public health nurse. My stepdad is a school principal for a lot of years. My stepmom is in health promotion, public health. My dad is a public health advisor. He's in public health. That's why I wanted to be in public health. You know, I think that got him the job. Okay, I'll with that. All right. We're done. We're all done with what we're trying to do right here. What we talked about. We're done with it. Now I want to take you to the future. We all worked hard. We all went through going before the committees, different committees, going through before the legislatures, the council, the state representative. Everything is done. MMDR is done. We're ready to go. It's in the system. We have our own database, and Navajo Nation has it. We're in the future now. It might be 5 years, 8 years. we're there. What I want to know is, what do you see? We're all like celebrating. We're getting ready to do the award ceremony. We're all happy. What's going on at that particular time? Anyone, what do you see? What do you feel? What are you experiencing? What do you see?
Fewer missing people. Fewer missing relatives.
Fear of missing relatives. Anybody else? Hashota.
I'm from the education side, but more education for the youth and high school and college students.
You got that? More education for the youth. Okay.
Supportive and healthy families for all.
Supporting and healthy families for all. We're writing this down really for our notes too. When we're done with this, when we're all at the completion, we will have it just, you know how it was all pretty up here, what we did in Shiprock? It was kind of messy when we finished it, but we'll get presented in that way. Okay, what do you see, feel, or hearing the group doing?
Better funding for our people, better services and resources, therapy, those kinds of things.
Okay, so at we're hashipang is the hojato hahot ad. Let's go in an Liago.
Hi. I kind of feel like maybe you guys need to get the communities and chapters involved. That way if you guys want to do the trainings, at least the communities and chapters are more involved and they get the word out there so they can have other people come.
Okay, so we're getting the communities involved by providing all that, what you just talked about. We're doing that at this point.
Authentic systems accountability.
Authentic system accountability. Diné.
Sharing data and collaborating with other tribes, federal, state, to work together.
Agency, state, and federal.
Providing a successful model for other initiatives that want to do data sharing on Navajo Nation.
Hello, I represent the family of Tyler Lambert, who was murdered in April in Gallup, New Mexico. What I would like to see is intensive and resourceful help for those families that are going through this and do not know where to turn. We don't know where to go. We don't know how long this is going to take. We have a lot of questions and no answers. So for someone to be able to say, hey, I'm here, come to me. And it's a one stop for everybody. That's what I want to see.
So we have services provided and then places to go identified where we can get assistance for the victims and what their needs to be met. And who do we talk to? Where do we go?
Yate, my name's Regina Eddy. She'e Tratnisahni, Nishlendo Kiani Bashachin, Lizatlana Dashachet, Twitchini Dashanele, and I'm originally from Pino. And I'm also a faculty member here at NAU. I'm also faculty member here at NAU School of Nursing. I think a couple of things, I think maybe it was already mentioned, but maybe have a clear understanding of all the stakeholders, who's all vested, and then better, I guess, collaboration among the different entities who are, I think it was mentioned the different entities, state, federal, tribal. I think that would be definitely, everyone's on the same page. And then also maybe policy gaps. We'll have a better understanding of, where the gaps are, and maybe at that point even have recommendations on how we can strengthen these areas.
Okay, now we're done. We're seeing, what are we seeing? What are we feeling at the end of what we're trying to do here?
Hello, my name's Thomas McKay. I'm with Tuba City Regional Healthcare. I think we'll have a lot more reliable data and be able to see the trends and all the numbers that we really need that will help us with our efforts.
Thank you. Reliable data and that we can use and help to help with all our efforts that we're trying to do. Ilato.
While we're talking about data and how we need to get access to data so that we can see trends and we can see patterns, something that's immediately doable, I think, is to think about how do we gather experiences and stories now from family and from people who want to talk about this. Being a commissioner of the Navajo Human Rights Commission, where we have done many public hearings, I raised questions at our commission meeting of how public hearings really don't get what we think we're going to get, because people don't want to make this public. They have a lot of reservations. They feel humiliated. They feel ashamed. They feel a lot of there's a lot of emotion into these stories. So there has to be, for the immediate, for now, how do we get this for the now, is maybe to think about how to get, like maybe do a survey, maybe do it anonymously, maybe allow people to sign into a place to share their stories, and they leave they leave a place where they can be contacted for verification. So that way you begin to start with the now of how immediate this problem or these issues are, is one thing that could be done immediately while we're still talking about how to get data.
Okay, when MDR is done, we would have stories and things that happen to the victims and also the victims' families without shaming, and that is free-flowing and accessible to communities so that we can learn from it and prevention and stuff like that.
Did I raise my hand? Scratching my head. Anyway, let's see what comes out of my head. Hello, can you hear me? Okay. I guess what I had on my paper was victim participation. I think there was a comment yesterday about, and there were victims at Shiprock, but they're not here. I think if you put yourself in their role, they want immediate impact. If they want help right now, and you keep retelling your story. You go meeting after meeting after meeting. Next thing you know, 5 or 6 years go down the road, and there's no change. So that's what they're wanting now, is immediate impact, and that's Delegate Crotty isn't here, but so at 4 years of training, we need legislation change now. That's not happening, so I think that's what we need, is change in legislation. We need the enforcement. We need perpetrator accountability. We need role responsibilities clearly outlined, networks, so we're referring properly and that they're available. Sovereignty of the data and data ownership is important, but then you don't want to hoard it as well, and that's what's going on now. There's no sharing, and then you're hoarding data. It even gets over to the state. I was over at state meeting in Albuquerque with a state epidemiologist, and I asked for data of some of the presentations, and I was told you have to get a letter from the Navajo Nation president. That's hoarding, and I was like, I'm an epidemiologist, I should have access to that data. So what about the communities if they wanted to put a proposal together so that they can address their needs? Does everybody have to go to the president now and ask for a letter? That's what it's come to. So anyway, so we can't be hoarding data, and I hope that we have a trauma-informed system that's, and also structural when we talk about trauma-informed, but yeah, it doesn't cost a cent to have some compassion and to be nice.
Okay, all the information that you mentioned are in place, and that's what we listed up there. So everything is flowing, everybody is getting trauma-informed care. Who hasn't? Okay. I'll go to her, and then I'll go back to you. Okay.
I think one thing that is cultural teaching. I was taught by my grandmother, yeah. That was the word that she used. And there was a bunch of us sisters. And she says, you don't look at strangers, you don't do this, you don't do that. And we were raised like that. That teaching is not going on today. We need to include our grassroots people in teaching our children today what is danger, they shouldn't try to get involved in.
So after we put MMDR in Data Institute, we have cultural teachings and traditional teachings in place as a prevention tool for our children. Anybody else? Oh, I thought I was going to go back to you. Sorry.
At this point of victory, while we're celebrating that this huge undertaking has happened, we're also going to be unveiling and peeling back a lot of pain, a lot of trauma that has occurred. That's always been there. So I think that creating jobs to go out and do community outreach, taking action on the data that's there and what people are going to see, it's going to be difficult to look at for some people, because even in this day and age, we still get the question about sex trafficking, human trafficking. Does that really happen now here on the Navajo Nation? That's what we face in our office, and it's very real. So this is going to unveil a lot, and I feel like we're going to need a lot of expertise and people in the field of healing to reach out to our people.
So when MMDR is finished, it's going to unveil and sort of verify what is been the concerns of the community, and more people will have access to MMDR Institute.
Hello, I'm a board member from the Tuba City Regional Healthcare, and what we see a lot is a lot of domestic violence cases. So what I would like to see in the Victory area is domestic violence shelters in every community where people have a second place to turn to, so we can prevent these horrible crimes coming in. And more support from police officers. We know that they're very thin, but we do our best to work with what we have, and I would just like to see our legislators pay more attention to that issue and give the funding that is needed to adequately fund those facilities so our kids have a brighter future growing up. Thank you.
Thank you. So we have shelters in every community after the day after.
And just one thing I do want to point out, and these are amazing end results that we're hoping to see. As we develop this data institute, I know we get questions as far as like, is this only centered on numbers? I mean, what else are you guys doing to address the issue? And we felt like we weren't really at that point just yet, but I also want you all to keep in mind that as you guys provide these recommendations and as the facilitators are writing them down, that through this we're also creating a community action kit to help communities mobilize, to empower them, to understand, not just the missing persons reporting process, but as you mentioned that, law enforcement is spread thin, social services is spread thin, all these services, that we should be relying on are very spread thin. So how do we empower our communities to really take control of when these incidences happen? So please keep in mind that what you're contributing here is going to go into that community action kit. So that's one recommendation of the space that we do want to come from, is the action part of it.
Community action kits will be available when MDR is, through all the information and all the process and the data that we're gathering right now, we'll have that toolkit.
I would like to say that in this room we've come from different disciplines, and I come from a critical Indigenous studies and Indigenous feminist and queer critique and settler colonial theorizing position. So we come from different places, and we definitely do need to have an analytic of how we are interpreting this data. People have talked about historical trauma as theorizing of how we understand what's happening here. And I want to say that historical trauma as theory has not been adequately critiqued. This comes out of the 1980s with Maria Braveheart. Nobody's been really critiqued it. So one of the things then is education at the community level, or just what I find as a scholar is that I'm constantly having to educate. And then the other thing that I want us to be careful about is, as we get older, we tend to romanticize and think that our lives were wonderful, our childhood was wonderful. It was really nice to be beaten. It was really nice to be lectured at all the time. When you're a kid, it's really not that much fun. And so when we're talking to young people, we really also need to have a centering where we're not lecturing them, but where we're having some honest dialogue and allowing them to speak, instead of us being old people who think we know everything, because we don't. And we tend to speak in a different way about our experiences than we did when we were younger. And we have to keep that in mind as well. A lot of the people who go missing are young people, are young women, are young LGBTQ, okay? And imposing on them our ideas of values isn't helpful, okay? Listening to them instead of talking at them is something that needs to be part of these forums of the toolkit of how do we talk to young people instead of talking at them. Talk with them and stop making value judgments, and that's really hard to do. I have to unlearn that every day. Teaching my first introductory gender and sexuality class, I had almost all completely freshmen, 30 students in that class, and what I found was that most of them, almost across the board, they did not learn anything about sex, sexuality, or gender in their families or their communities. They learned it from the outside, because all of a sudden we're like, oh my God, we can't talk or say these words. Yi yapa hatsid, it's sacred. And then you're like, well, where are they going to learn it from if you don't even have the honesty and the courage to sit down and talk to your young people yourself, And so we need to put that as part of the toolkit, is how do we talk to young people without sounding like we have the credentials of Yoda.
So when we have the MMDR Institute in place, young people feel validated and they have a sense of ownership in the Institute, where they can express themselves and teach one another and teach us what needs to be in that. And then also different people come from different backgrounds and different diversity, and then also studies in the academia and the theories and stuff like that, be all included in here. Okay, we'll do one more.
Just real brief, I'm sorry. I work with the Bureau of Indian Education. I echo the same views that you echo. And when the reality is, when students need to make a disclosure, they need to find someone safe to talk to. Like young lady right here, could possibly not speak to her mom about something that she got a text over her phone, but she has to be able to go to a safe person within the school, whether being a teacher, most likely be the counselor at that school. So if you have counselors within the school doing counseling, And when I echoed education, students and youth, they need to be able to go to somewhere safe. But that goes into creating a curriculum, a counseling curriculum. There's a curriculum called American School Counselors Association Comprehensive Competency-Based Guidance National Model. So within that model, you do guidance lessons, individual counseling. But counselors on the reservation, I work with all the six BIE schools and 186 nationwide. So our biggest thing is how can we enhance our counseling programs. A lot of our counselors do non-counseling duties. So, and the echoes are with state and private schools. But if counselors are doing counseling where a young person can go to someone safe and say, this is what's going on, and that would be a big preventive issue. But all the counselors, and if you can put that as a victory, where counselors on the Navajo Nation are available, but are following the national model, where it provides counselors the availability to do counseling so students can feel safe and a safe place to disclose. Because if you don't have that, the kids are going to hold it within themselves. And then your prevention point comes with guidance lessons with the students as a counselor or from a community member saying, this is what you got to watch out for. Because students, in all honesty, back in our day we had the telephone, we talk like that, we talk like this. Students today, they talk like this. And a lot of the communication is not like this. And it goes to social media, TikTok, Instagram, and the social media is just blown up. So we had to provide the education to students that this is how these people are going to try to get a hold of you, period. They're not going to be out there looking for you, but they'll lure you in. It's just like that catfish. You watch that catfish. That was super funny on a... Yeah, in that sense, it's kind of funny, but at the same time, that's reality. I work with students in the schools, and they say, yes, so-and-so is trying to hit on me via my cell phone. I don't know who this person is. And so we had to get that awareness out there that you have to be mindful and ready. So little two cents on that. But if you can put that on, that'd be very helpful. Thank you. Yeah.
Good, so that way our children, youth feel safe to come forward to somebody that kind of understands what their world is like instead of us trying to get them involved. So this is how it is. We have the institute established. I know there's more, and I know some of you are probably like, these cheaters, no, and but it's, I'll just read a couple of them for the interest of time, and I'm sorry if I don't read yours, but there's a lot up here, and the scribes will rehash it out and list every one of them. But this is how what we talked about is that, young people have a safe place to talk to, and then, yeah, go ahead.
Sorry about my handwriting. Okay, so young people have a safe safe person to talk to. Counselors at school, reliable data, see trends, help with our efforts, analytic of how interpret the data, get community chapter involved, get the word out, more people will come, provide successful models for data sharing, collaboration, critique historical trauma, educate at community level. Let's see, which one would be good? Domestic violence shelters in every community, funding to facilities, and police support. Those are just a few.
So this is what we have now. So you mentioned something that was a grandpa, the indigenous. Our people have become very spiritual. He says that anytime you see our people walking, they walk like this. Or either that, when they're sitting down, they're like this. Like they're really, it's everybody's doing this these days. That's what he's talking about. Everybody's on their smartphone, so everybody's spiritual now.
Okay, I'll stop praying. Let's see. So, leave that. Can you move this one on this side here? Yeah, leave that one up, Randy. Leave that up. Okay, so now that we are done with the brainstorming, because what Randy did was he took us to the future. He took us to through a brainstorming activity that really looked at what success would look like once we had the Data Institute in place. So now, that's great to envision our success, envision our destination, but let's bring it back to reality, right? What's going on now? So what we want to do is, as we begin to look at creating and developing an MMDR Data Institute and all that that entails, we need to look at what's our current reality, what are we currently working with? So what strengths do we currently have in place here within the collective, in this room, and also those who were a part of the Shiprock Institute Forum, and also those collaborators that we know that we're going to be pulling in to be part of this collaboration. But what are some strengths that we currently have as a collective?
I think one of the current strengths that we have here is just the dedication from the volunteers that are working together.
Awesome. All you fabulous people.
There is a lot of fabulous people in here. I like some of the current reality and some of the things that are doable. I think are really important, like old people like me are not very tech savvy, and I'm not that good with social media, but that's what gets the kids. So something that's current reality is where they're getting their message from and how to do a social media campaign, you know? And then the other thing that's the current reality is I'm also an educator, and I go out to educators on the Navajo Nation, administrators, and the young people, when I talk to young people, they say that their teachers and their administrators, their principals, are the ones who are the most homophobic, the ones who discriminate against them based on gender. And so what's the reality right now is that we can have young people, or we have people already available who can do trainings to school administration, to principals, and just go, you know, and then have the young people also, because there's a group in Shiprock of young people who are already doing the group. When I went to Chinle, I shouldn't even name the place that I'm going, I realized that the administrators and the teachers are sorely in need of education on gender. And how is this related to missing and murdered? It's related because many of our young people are the ones who have to go to urban spaces because their families reject them. Okay? I had a relative who I didn't know, and I met him, and I said, "Tell me about your family. I don't know, you know, this is the second time I've met him." And he told me, he says, "Two of my daughters came out to me as lesbian, and I threw them out of the house," he said. Okay, so this is connected because young people will go into cities because they have to reform their families and reform their communities. So to have people just train and talk to other people as administrators and principals, that's something that's the current situation, okay? A couple of years ago, I was at Navajo Prep, and I was talking about this from a human rights perspective. And the principal and one of the administrators came up to me and they said, "We think we're heterosexual, most of us in this room, because we don't know how to mix up our group. We don't know how to invite non-binary conforming people into our community, to the families. We have such entitlement as heterosexuals." So one thing that when I talked about this at Navajo Prep, the principal and one of the administrators came up to me and they said, "We can make a gender-neutral bathroom." They said, "It's not that hard." You know, young people are holding their bladders all day because they can't go into the bathroom of the gender. I mean, to us, that's nothing. You're talking about people who are tortured because they can't go into the bathroom. Okay, so this makes them leave their communities, this makes them leave their families. So making these connections, and that's a really easy thing to do, you know, so there's doable things.
Thank you for that, and you touched on a lot of great points in terms of our current realities, both strengths and some of the strengths and some of the potential barriers, and I love that you talked about chosen family. Because each one of us here, we have our birth family, the family that we're born into, but we also have a collective, whether you identify as cisgender male, cisgender female, transgender, LGBT, we all have a chosen family that we select, that we begin to feel close to. And we talk about as our clanship. Think about that too. That's If you go to a clan relative, that's your chosen relative as well. That's your chosen family. You're reaching out to them. So I think that's a concept that we tend to forget about, that we all have a chosen family, it's not just an LGBT thing.
We just found out we're Hashkahazoa. And one of Zoe's strengths is she's ambidextrous. But I want to add that we're all passionate and invested in what we're doing.
Hi, I'm Deb Harrison. I'm looking around the room, and thank you, first of all, for making me feel so welcome in this space. But I used to work with Parent and Family Services at the university, and one thing that I know about parents is that they all want their children to be happy and successful, but they don't really know how to do that. So I think the strength that we have is we have lots of people in our community who know how to help parents, help their kids to be happy and successful and thrive. And so maybe it should have been over here in the Victory, some type of office of Parent and Family Services with a specific goal to help parents help their kids to be successful, which might get at some of the issues of why kids leave or why they're so easily strayed or pulled out of the community, is to find a way to help them help their kids.
Happy families help their kids, great. We definitely have that, and if we can do more of that, definitely we could add that to our Victory.
Besides the database, we have other technology that's available, like surveillance, drones, and even the cell phone. So the strength will be technology is already available.
Awesome. What other strengths do we see here as far as the collective that we have? Part of our current reality, what other strengths can we tap into?
I think we have a lot of young professionals who are very forward in contributing their expertise and are very action-oriented.
Definitely there. So do we feel that we've kind of exhausted some strengths for the time being? And we can always come back to those, okay. Awesome.
I think that there's also, just to follow up on that, there's also a lot of older people that are retired and looking for things to do that we could teach and mobilize to use the right words and create accountability or do all kinds of stuff, really.
Mobilizing each generation at their level, so that's awesome. So now let's begin to think about what are some weaknesses that we may have identified after having been part of the first forum in Shiprock, listening through all day yesterday and then this morning. What are some of those things that you may have thought about that we may be lacking internally as a collective?
I think what is lacking is a lot of support for the families, especially when it first happens, when they first go missing, when they're first murdered. They're so stressed and grieving, but there's nowhere to go. Who do you trust? Do you trust the police? Do you trust your Navajo Nation police? Do you trust the counselors that are coming to you? We do not know. We don't know if they're talking to the assailant's family. We don't know what's going to happen in the future. I had no answers. All I know is that the person who committed the murder is in jail. I don't have any kind of dates. We don't have any kind of justice right now. There's no timeline. There's no points of order that I need to complete.